COVID-19 continues to spread. Global cases are past 60 million, deaths over 1.4. But hope has arrived in the form of 3 apparently highly effective vaccines, announced one after the other in November. That prompted a surge in the number of searches about them. And everyone's asking, when can we get the vaccine? Well, to answer that, there are several factors. The first is global demand. An estimated 7.5 billion doses are needed. That's because around 60 to 70% of the global population has to be vaccinated. This is why.
If you have a highly efficacious vaccine and only a relatively small 40–50% of the people get vaccinated, you're not going to get the herd immunity you need.
And without herd immunity, the virus will continue to spread. So the demand for this vaccine is vast, which takes us to the second factor, capacity. Pfizer and BioNTech estimate they can produce up to 1.3 billion doses by the end of 2021. Moderna up to 1 billion. AstraZeneca up to 3 billion of the Oxford vaccine. Huge numbers, but look at this from the WHO, saying the only certainty is that there won't be enough. And if there aren't enough doses, our third factor is which countries take priority. In short, the richest ones will. We know the UK, the EU, the US, Australia and others have cut deals to receive millions of vaccine doses, and the WHO is worried.
There is now a real risk that the poorest and most vulnerable people will be trampled in the stampede for vaccines.
There is a plan to stop this. It's called COVAX, and already almost 100 countries are agreeing to share vaccine resources fairly, regardless of a country's wealth. That will help, so will humanitarian groups funding affordable vaccines, but only to a point. Where you live will affect when you get the vaccine. Next, we have to consider your age, your health and your job. The COVAX plan prioritises health and social care workers. Then this is Emmanuel Macron on the French approach.
We will probably start at the end of December, early January, subject to validation by the health authorities, by vaccinating the most fragile people, and therefore the oldest.
The UK too is prioritising the elderly, the vulnerable and essential workers. That's the start. Beyond that, the head of the UK's vaccine task force said in October, people keep talking about time to vaccinate the whole population, but that is misguided. It's an adult-only vaccine for people over 50. In other words, some adults will get it, not all. Then in the US, this is President-elect Joe Biden on his ambitions.
We'll need to put in place a distribution plan to get the entire country immunized as soon as possible, which we will do, but it's going to take time.
Well, whether an entire country or some of it, he's right, it's going to take time. The question is, how long will this take? Well, this is a vast logistical challenge. So while vaccinations may start this year, if you're not elderly, vulnerable or working in health or social care, the WHO says you may have to wait till 2022. There are, though, some who aren't having to wait at all. In China, hundreds of thousands of people have taken state-sponsored experimental vaccines. In Russia, its vaccines being used on a range of essential workers. Even one of Vladimir Putin's daughters has had it. But none of these vaccines have yet completed industry-standard trials. And finally, there's the issue of people who don't want it at all. These are anti-vax protests in Germany. And a report recently published in The Lancet found that 31 million people follow anti-vax groups like this on Facebook. We can't know what impact these will have on the push for widespread vaccination, but we can be clear on one thing. While demand for the vaccine is huge, those who don't want it won't be forced to take it.